All right, let's dive into this stack of notes you've shared on illness anxiety disorder used to be called hypochondriasis, right?
That's the one.
Okay, so the mission for this deep dive is basically to turn these notes into like the ultimate audio revision guide for you.
Exactly. Flashcards for your ears.
Love it. We're going to hit all the key areas you've outlined, from the definition right through to complications.
Yeah, we'll cover the lot. Goal is just to make it super clear, easy to recall.
Perfect. Let's jump straight in then. The core definition, what IS, illness anxiety disorder, according to your material.
Okay, so at its heart, it's this really excessive, persistent fear of having a serious medical condition.
Right, but the key is?
The key is this fear exists despite limited or, often zero medical evidence to actually back it up.
So people misinterpret minor things.
Totally. Tiny bodily sensations get blown way out of proportion, seen as signs of something awful. And importantly, they often struggle to accept reassurance even from doctors.
That resistance to reassurance sounds tough. Okay, so that's the what. Let's talk about the why, the etiology. Your notes mention a mix of factors.
Yeah, it's definitely not just one thing. Your sources point to a complex interplay. You've got biological factors, maybe genetic predisposition,
Okay.
psychological stuff, like certain personality traits, neuroticism gets mentioned, and also anxiety sensitivity.
So how anxious you get about being anxious.
Sort of, yeah. And environmental things, too, like childhood experiences and this tendency some people have to catastrophize, to always assume the worst. It's a real mix.
Right, a complex picture. Building on that, you've got specific risk factors listed. These seem like good memory hooks. What are they?
Yeah, key things to flag are family history. So if anxiety or other somatic disorders run in the family,
Makes sense.
a history of childhood abuse or neglect is another one. Then there's that neuroticism trait again, and also having had a significant illness or maybe some medical trauma in the past.
Got it. So if those are the risks, how does the disorder actually, keep going? The pathophysiology bit.
Ah, the cycle. Okay, so it seems to be driven by this heightened sensitivity to just normal bodily sensations, things most people wouldn't even notice.
Okay.
But then these sensations get misinterpreted through this lens of fear. There are cognitive biases at play, like paying way too much attention to your body or jumping straight to the worst conclusion.
That catastrophic thinking again.
Exactly.
Hmm?
And that creates this loop. Anxiety makes you focus more, focusing makes you misinterpret more, which ramps up the anxiety, and round it goes.
That's exhausting. Okay, so when someone presents like this, what else needs to be on the radar? The differential diagnoses in your notes.
Yeah, super important to rule other things out. Your sources mention other anxiety disorders, obviously. Also, other somatic symptom disorders, where physical symptoms might be more prominent.
Right.
OCD, specifically the kind with health worries, needs considering. And also factitious disorder imposed on self, what used to be called Munchausen, where someone is intentionally faking illness. Very different.
Good distinctions. Let's zoom out epidemiology. You noted the UK context specifically. How common are we talking?
The figures in your notes suggest about 1% to 5% of the general population in the UK, and it seems to affect all ages and genders pretty equally.
1 to 5%? Wow, that's actually quite a lot of people. So, clinically, what does it actually look like? The features.
Well, the core is that excessive preoccupation, the constant worry about having this specific illness. Then you see behaviors driven by that fear. Lots of reassurance, seeking frequent doctor visits, maybe demanding tests.
Okay.
And also excessive health-related behaviors, constantly checking their body, spending hours searching symptoms online, that sort of thing, all leading to significant anxiety and distress, obviously.
That online checking point feels very relevant today. How do doctors investigate this, then?
Right, so the notes stress it's primarily a clinical diagnosis. It's about the detailed history, the physical exam, a proper psychiatric evaluation.
Not necessarily finding something on a scan.
Exactly. Lab tests and imaging are often done, yeah, but mainly to rule out an actual organic cause for the symptoms the person is experiencing, even if minor. Usually, the tests come back normal, not supporting the person's big fear.
I see. So diagnosis is more about the pattern. Okay, management. Again, thinking UK context like you mentioned, what's the approach?
It's multidisciplinary. CBT, cognitive behavioral therapy, is highlighted as really key in your notes.
What kind of CBT techniques?
Specifically, things like cognitive restructuring learning to challenge those fearful thoughts and beliefs. Exposure and response prevention, helping people resist the urge to constantly check or seek reassurance. And mindfulness techniques, too.
Okay, practical tools. What about medication?
Pharmacotherapy might come into it, yeah, especially if there's significant co-occurring anxiety or depression. But the main thrust is therapy challenging the beliefs, reducing the anxiety behaviors. Regular follow-up is important too.
Good list of CBT techniques to remember there. And the prognosis. What's the general outlook?
It varies. Your notes suggest that with the right interventions like CBT, people can see significant improvement, less anxiety, better day-to-day functioning.
Right.
But for some individuals, it can be more persistent, and might need ongoing management long term.
Right. And finally, the downsides if it's not managed well. Complications.
Yeah, the notes list some serious ones. A major impact on quality of life and just being able to function daily.
I can imagine.
Huge healthcare utilization, all those tests and visits add up, a high risk of developing other issues like depression or other anxiety disorders. And sadly, there's also the risk of iatrogenic harm.
Harm from treatment itself.
Yeah, harm caused by unnecessary medical tests or procedures that stem from trying to find a non-existent illness.
That's a sobering point.
It is, which leads to a thought, perhaps. Considering everything we've discussed, the sensitivity, the interpretation, the biases, how do you think our modern world, with instant access to endless medical info online, might be, well, impacting or even maybe reinforcing conditions like illness, anxiety disorder today?
Oh, that's a really interesting question to ponder. The whole Dr. Google effect, potentially feeding that cycle, definitely something to think about. Well, we've covered all the ground from your notes definition, causes, risks, the mechanism differentials, the numbers, features, investigations, management, prognosis, and complications.
Hopefully running through it like this kind of focused deep dive, really helps cement it for your revision.
Absolutely. And if you listening found this approach useful for tackling a specific topic, you might want to check out resources like passthemsra.com and also freemsra.com. They could be really helpful for exam prep, like for the MSRA.
It's not worth a look.
For now, keep learning and keep exploring.